In Nepal, eyes are more than a sense. They are symbols of clarity, awakening, and connection. Yet, for millions worldwide, this light dims too soon. Not by fate, but by neglect, lack of access, or unawareness. At least 2.2 billion people live with vision impairment. 1 billion cases could have been prevented or treated.
Our core belief as a team is that just because of where you're born, everybody has the right to sight. Everyone should be able to see. Avoidable blindness is something we know how to fix. We have the technology. We know that it's safe. And Seva's approach is to work closely with Indigenous and local organizations and individuals to jointly solve the problem in their communities. So our entire way of working is science-based, but local understanding and local respect. And those two combine to make it very sustainable. We've been able to prove through our own research and collaborative research that low and middle income countries lose $1 trillion a year in productivity due to vision loss. On top of that, we are also able to prove that for every $1 you invest in eye care, communities get $36 in both social and economic benefit. So for every $1, $36 is coming back into the community, making it a really best buy in health. We've worked collaboratively with local scientists and community outreach individuals in order to make sure that the science that we understand about how to address vision loss is executed in a way that's going to resonate and make sense with the local community. That's the reason why we can do it swiftly and efficiently and affordably.
Seva started working in Nepal from 1978-79 with the Nepal Blindness Survey. It was a population-based survey, the first of its kind in the world. This survey quantified the prevalence of blindness in the country and also provided us the causes for the blindness. Until then, it was thought that trachoma was the primary cause of blindness in Nepal. But the NBS survey, it revealed that cataract was the primary cause of blindness. Based on the figures that came from the survey, resource allocations were done at the appropriate places, and at the ground level, community vision centers were established to reach the people in the community where cataract could be identified. One of the highlights is that the first vision center, which was established in Palpa, was supported by Seva and now is a center of excellence providing care to a lot of people. Inbuilt into that was world-class technology, using latest state-of-the-art equipments, but technology which is best fit for the country, technology which will provide services to the most remotest of the areas without having the patient pay the price for it, and technology which will allow the people on ground to train for difficult surgeries or to understand difficult conditions in the eye. Technology will be the best thing going ahead.
The Nepal success for me and I think for others that work at Seva, it's the proof point that you come in with an open-ended question of what is holding this community back from a health perspective. We conducted a comprehensive epidemiological study back in the early 1980s. That exact study, till this day, is something that people keep referencing. So in many ways, we really had the long view. We understood that you have to come in with an understanding and an appreciation for what the community needs. Guatemala Brillando, for us, is hopefully a proof point back to the international community that this is a problem money can solve. We've chosen a country that has a terrific track record, an extraordinarily talented local partner, and a country size that within my lifetime, within the next 5 years, we believe we can have the systems in place so that it is no longer one reason why people are poor in Guatemala, that they will have access to the care that they need.
In Guatemala, eye care was once out of reach for millions. Since we started, we established a residency program, and now we are training our own residents in ophthalmology, so far 6 ophthalmologists. And also, we start a subspecialty program that includes anterior segment, retina, and oculoplastics. Also, we already graduate our first 2 anterior segment specialists, and they are trained to do cataract surgeries, refractive surgeries, everything related to the anterior part of the eye. Now families and children have access to eye care. We have provided many classes for these kids who otherwise wouldn't receive that by doing these screenings in schools.
Because of my grandfather and my father and so forth passing on money to me, I have felt a profound sense of responsibility to be of service, Seva, which means service in Sanskrit, to put that to human betterment. And I think I always came to this. I've been giving even before 1978, but organizations that have that intercultural organizational humility and have at the same time science-based reality, it's not easy to find that. And it's also not easy to find organizations that are good stewards of my gifts. My brother and I both have found this over and over. It's organizations like Seva that I feel my strongest pull towards.
The kind of impact that sight has, and when you're privileged enough to do the kind of work that the Seva team does, every one of us has had a story. We have a moment where it's almost impossible to help someone understand how powerful it is to sit in front of somebody who might not have been able to see for years because of a cataract. And then after a 15-minute surgery that cost about $50, they're now being able to see clearly.